There is a peptide called Retatrutide. The FDA has not approved it. Roughly 500,000 Americans are already injecting it. Its unique mechanism is that it tells your liver to burn its own fat, aggressively. Some livers do not survive that command intact. This is what that looks like, from the inside, stage by stage. The first 6 stages are invisible. Stage 7 is where the liver does not come back. Stage 1, the fat surge. Retatrutide is what doctors call a triple-agonist. It activates 3 receptors at once: G, L, P, 1, G, I, P, and glucagon. The glucagon receptor is the one that does the damage. In a healthy body, glucagon fires only when you are fasting. It tells the liver to release energy. Retatrutide tells the liver to release energy every single hour of every single day. The liver thinks it is permanently starving, so it starts dumping fat. Stage 2, the lipolytic fire. In clinical trials, Retatrutide cut liver fat content by 80% in less than 6 months. That is the marketed effect. That is what the buyers are paying for. What is happening underneath that number is not in the marketing. When the liver burns fat that fast, the mitochondria inside each cell are forced to work past their design tolerance. Stage 3, hepatocyte stress. Your hepatocytes are the worker cells of the liver. They are now producing reactive oxygen species faster than they can neutralize them. This is oxidative damage, at a cellular level, invisible from the outside. The first inflammatory signals begin to fire inside the liver tissue. The user feels none of this. The scale keeps dropping. The reflection in the mirror keeps improving. The damage is perfectly silent. Stage 4, enzyme elevation. Damaged hepatocytes leak 2 enzymes into the bloodstream, ALT and AST. A simple blood test catches them. In Retatrutide trial data, these enzymes routinely climbed to 2 and 3 times the upper limit of normal. A baseline blood test would have caught this immediately. Almost no gray market user gets a baseline blood test before starting. Almost no gray market user gets one after. Stage 5, drug-induced liver injury. In a subset of users, the enzyme elevation does not stabilize, it accelerates. This is idiosyncratic hepatotoxicity. It happens to some people, not others. No one can predict who. There is no warning, and there is no premonition. The first symptoms are abdominal pain on the right side, under the ribs, fatigue, nausea after food. Most people blame the drug for the nausea and ignore it. Stage 6, the cholestatic cascade. Bile flow inside the liver disrupts. Bile is meant to leave the liver and enter the small intestine. Now it backs up. The skin begins to yellow. The whites of the eyes turn gold. Urine darkens to the color of tea. This is jaundice. This is the body waving a final warning flag. This is the stage at which the user finally goes to the emergency room. In most cases, the drug is stopped immediately by a hepatologist. Stage 7, rebound steatosis. The drug is gone within a week, but the liver has been retrained. For months, it has been told to burn its own fat. It learned. Now the signal is gone. But the cells are still tuned for fat dumping. Insulin sensitivity is rewired. Lipid synthesis pathways are scrambled. The body cannot remember how to store fat correctly, so it stores it everywhere, including in the liver, faster than before, deeper than before. In some patients, worse than baseline. From the outside, a person in stage 7 looks like they are simply gaining the weight back. Inside, the fire it was taught to start. It cannot stop. There is no baseline at stage 1. There is no test offered at stage 4. There is no coming back from stage 7. If you are on Retatrutide or any peptide, do 2 things. Get a baseline ALT and AST blood panel before your next dose today. Repeat the blood panel every 4 weeks. If your ALT climbs above 3 times the upper limit of normal, stop the drug. Call a hepatologist that same day. Send this to anyone you love who is buying peptides without a doctor. The next video goes inside a different organ. The story is just as quiet and just as irreversible.